In total, the bipartisan report makes 30 recommendations covering 6 areas. Committee Chair Delegate Rodney Willett says their work took them around the state, and the top concern they heard in every corner was transportation. So they're recommending creating or supporting programs to help get people to their appointments.
And that particularly becomes a problem when you think about, for example, a pregnant mom who it's not one visit, it's multiple visits, the prenatal and then the postpartum care.
Another topic is obesity, and among the recommendations is lowering the threshold to access weight loss drugs.
There's so many lives that could be saved because there's so many comorbidities that come from obesity.
The area that received the most recommendations was around workforce shortages in both the medical and dental fields.
This leaves patients without access to care, often forcing them to travel long distances or forego essential medical services altogether.
The suggestions include grant programs to attract new hires, childcare for workers, and expanding support for people training to work in these fields.
I call my husband and I say, hey, babe, the pain is back, but it won't leave.
The committee also made several recommendations around maternal health, an issue that seems to be getting a lot of attention heading into the 2025 session. Democratic leaders laid out their so-called Momnibus bill Monday, and Governor Glenn Youngkin discussed it during an event Tuesday. There, Jasmine Storr shared her story of a heart attack 2 weeks after having her third child.
The biggest takeaway from just my story is education. Like, what I know now, if I knew then, I really felt like my outcome would have been different.
But in 2021, there were 64 pregnancy-associated deaths in the Commonwealth of Virginia.
Youngkin says of that number, experts estimate 80% are medically preventable. He says among his goals to address the issue is an executive directive to report actionable data on maternal mortality, expanding doula and community health care worker programs, and allowing midwives licensed in other states to work here.
The combination of some real common sense access, telemedicine and mobile, on top of using the managed care organizations to target better and building workforce have to work together in order to close this gap.
And of course, many of these recommendations will be reliant on finding the funding for that, and all of that really comes together starting on Wednesday when Governor Glenn Youngkin will kick off the budget process with the presentation of his proposed amendments. At the state capitol, Cameron Thompson, CBS 6 News.